Hey, in this video, I'm going to give you my honest physical therapist review of the AleveX pain relieving lotion and pain relieving spray. Now, the active ingredients in both of these products is camphor and menthol. Now, the labels on these products read that they're appropriate for use with sprains, strains, bruises, backaches, and arthritis. But before I dive into that, let me just tell you a bit about the active ingredients in these products, camphor and menthol. Both of these are 5.5% camphor. Now, the camphor ingredient is derived from the camphor tree, so it's actually a natural ingredient. Parts of the tree are broken down and distilled, and then they pull off a camphor oil, and that's what's put into products that use camphor. Now, camphor is scientifically proven to be beneficial for pain relief, so that's pretty cool. We've got a natural ingredient in here. Camphor is also found in other topical analgesics or pain relieving creams like Bengay and Tiger Balm. The other active ingredient is menthol at 16% in each of these products as well. They're both the exact same percentage of camphor and menthol. Now, menthol is derived from the mint plant, so it's also a natural ingredient. They use mint plants that they distill down to pull out the mint oil, and that is eventually formed into menthol. Now, menthol is found in a bunch of pain relieving creams and sprays and balms. The most popular one that uses menthol is probably going to be your BioFreeze. Now, we put links in the description below here that have research articles for both camphor and menthol. So if you're into the research on this stuff, there actually are things that work. Now, where this is a little bit different from typical Aleve, the Aleve brand, is that Aleve is Naproxen. Naproxen is a chemical that's made in the lab. It's from the non-steroidal anti-inflammatory drug medication family. And that's what you find in over-the-counter Aleve pills, the medication that you'll take. But this is not Naproxen. This is camphor and menthol, very similar to like Tiger Balm, Bengay, and BioFreeze. The difference is the concentrations are not the same, and of course the way that you apply the product is different. Now, they do also have a lotion bottle where you can squirt it onto your hand and rub it in. I did not get that one because it's kind of what you typically see. Everybody is familiar with that. These are a little bit different. So let me show you how these go on. I'm going to start with the spray. And the instructions for this are to spray it on 3 to 4 times a day. It doesn't say exactly how much to spray on, but it's supposed to dry really fast. So let me show you what that looks like. The cap comes off like that, and it's got a little nozzle right there, and you just push your finger like on the top right here like you would a spray can or any other spray device. And let me get my forearm close for you here. Just like that, you spray it on, and it's wet. It feels a little cool. It's not bad at all, but it's already drying. It's pretty fast to dry. And so you can get a whole area just like that, depending on what you need to treat. And the odor is really nice. It's got a menthol smell, so it's kind of minty. And it's already developing like a slight tingling, cool sensation. It's not uncomfortable whatsoever. It feels really nice. I think because of the camphor typically has a delayed response. It's not real strong right now, but what I found with camphor products is that the sensations tends to last a little bit longer wherever you put it on. The other product that I have for you here is the lotion. Now, I thought this was so cool. I've never seen a product like this. Maybe I've just missed it, but they've got these little roller balls on there, these little kind of bearings or little metal marbles that are encased in the plastic tip right here. And so when you roll it on, it pulls some of the lotion onto the ball, so you're not having to touch it with your fingers and get the menthol and the camphor on your fingers. So the way you would put this on is you just roll it on like so. You would shake it, of course, first, make sure that it gets to the top, and if you push it down and give it a little bit of a squeeze, it gets on there. And you can, I don't know if you could see my skin glistening from the lotion that's coming on, but it puts a light amount on there, which I like because you can control how fast it goes on. You know, with some of these squirt bottles of lotion, it just all comes out real fast sometimes. You have to be real careful to just give yourself a little bit. But this applies just a nice amount, and it's kind of massaging at the same time. Those little metal balls give you a little massage effect, but you don't want to put too much on in case this is the first time you're trying it out. It has the same odor as the spray. It just doesn't hit you as fast because it's not a spray. It rolls on, but it's got that menthol feeling again. It's starting to tingle. It feels cool, not uncomfortable at all, And I can smell a little bit of the camphor as well. Camphor has a unique smell apart from menthol. I mean, the camphor typically comes on and lasts a little bit longer than the menthol does. Now, the only side effect they've listed on here is irritation to your skin. So if you start getting redness, a rash sensation, or it looks like a rash, you need to stop using this. And if the redness continues to last more than a few days, go see your doctor about it for sure. Now, the warnings that they give is you shouldn't be using this for more than a week at a time. You probably have some other condition that needs to be seen by a healthcare professional if you're just trying to treat your aches and pains with a cream and a spray like these products. And then it's advised that you go see your doctor, talk to your doctor first if you're looking at using this on somebody that's less than 12 years old, 12 years or less, or if you're pregnant and you're looking at using these as well. And my honest physical therapist opinion about both these products, I like them a lot. I think these are great to keep in your medicine cabinet right next to any pain medications you might have. They're great alternatives, natural. Remember, they're not drugs like normal Aleve. They're not over-the-counter drugs. These are made from natural ingredients, menthol and camphor, which are derived from the plants themselves. So I like them a lot. They do give a cooling effect and can help you with some pain relief. Now, these are just temporary. They're not designed to take away arthritis pain. They're just going to provide you with temporary relief, which is just as good, in my opinion, as taking an over-the-counter pain medication, because that only provides temporary relief as well. But that being said, you need to be looking at fixing the root problem of whatever problem you're dealing with. Say if it's an arthritis problem, you need to look at changing your muscle balance around the joint so that you can take pressure off the joint for the long term. But that's not something that this is going to do. This does, however, buy you some time, get you some better sleep at night, allow you to get through a time where you have to be on your feet, maybe going to the store, being on a vacation, being on your feet a little bit more than you normally would. This can help you out at the end of the day or right before you're going to go do that activity. The other cool benefit of these is they're lotions. They don't leave any oily residue. Like right now, this just feels a little moisturized, but not oily. So this is not going to stain your clothes, and it doesn't leave that oily sensation on your skin or on your fingers. And then the other benefits of these is you don't have to put it on your hands, which means you don't have to worry about going to go wash your hands right away. However, if you do by chance get it on your hands, you need to go wash your hands, because getting that menthol or that camphor in your eyes, in your nose or your mouth, or any openings on your body whatsoever is not a comfortable sensation, and they do advise against it on the labels on these products. Hey, I hope this video was helpful for you. If you've got any questions, drop them in the comments below. We love to get back to those as soon as we can. And if this is your first time checking out our channel here, my name is Dr. David Midoff, and I'm a specialist physical therapist. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. We make helpful videos focused on giving people tips, advice, exercises, and stretches for a variety of conditions. And you can find the condition that you're dealing with over in our playlists. Just go down to the description below and you'll find a link to our playlist, as well as links to getting these from Amazon, which is where we got them from, and other links that might be helpful for you too. Thanks so much for watching, and I'll catch you in the next video. Bye-bye.